Hi, everybody. My name is Tom Novacheck. I'm a pediatric orthopedic surgeon. I've been at Gillette Children's since 1991, when I had the pleasure of joining, amongst other people, Steve Koop, who's here to my left.
Yep, I'm Steve. I came to Gillette in 1985, and like Tom, I'm a pediatric orthopedic surgeon, but I'm retired now, and I've been away from patient care for about 3 years.
So some people ask why we endeavored to write this book. In fact, this is, in all practical purposes, the fourth book in the series, starting with Dr. Gage's book in 1991, his monograph about the use of gait analysis. That was followed by a multi-authored text to the first edition of officially of this series in 2004, and followed by the second edition in 2009. We wanted to follow this up with an updated version that was essentially part of the series, but differed in significant ways.
And a lot has happened in 15 years in the care of children with cerebral palsy. And we thought it would be important to bring to you what one institution or organization, Gillette Children's, does to try to provide the best care possible for children who have cerebral palsy that disturbs their walking.
So Steve, maybe you could tell people how you think this version is different than what we've done before.
Well, one of the things that has changed in the last decade is the active inclusion of families and patients in decision-making processes regarding treatment. There are now a number of validated tools and methods to elicit from parents and from patients their priorities so that we can learn from them what matters. We wanted to bring that to this edition.
But when you set out to do this, we decided that we would do something a little bit different than the previous versions.
Well, for one thing, we wanted to portray the process of working with a family across a child's growth years. And so we organized the book differently.
So the book is divided into three sections based on age, and basically on ages based on when children might be candidates for some type of surgical intervention. So the first section is in the earliest years, ages 4 to 7, when we might be considering spasticity control. The second stage is the more juvenile years, when children are growing and might be at those ages where they be candidates for orthopedic surgical correction. And then the third section is adolescence, and could be also applied to adulthood when problems like crouch, progressive foot deformity, or acetabular dysplasia become significant concerns. And so it is divided by the ages, but maybe within each of those ages, Steve, you could talk a little bit about how we've organized each section.
At the beginning of each section, we have a chapter that talks about what we have learned from parents and children about the priorities that are important to them in that age group. So that starts out each section and gives the reader a little bit of perspective about the decisions they will need to make. Well, from that point on, we get into the interventions that can be considered for the children, largely by body area after tone reduction has been done in the early years. And we tried to make each of those chapters as consistent in format as possible.
And then those surgical chapters, we all have recognized all along that rehabilitation is a critical component to the success of a surgery.
That's right. This is not a book that tells surgeons how to do the surgery. It is a book that talks about how a team approaches children in each of these age groups. And that means making the decisions with families, carrying out the surgeries, and then reaping the benefits of that surgery through carefully done rehabilitation. If rehabilitation is not done well, the technical results of the surgery will never, ever be fully reached.
Yeah, so each of these sections by age are followed by a chapter written by the therapists at our organization. and they have outlined the protocols that they've developed over a very long period of time to follow up on each of these interventions to try to maximize the benefit of the surgery.
That's right. And they emphasize the importance of helping parents understand before surgery what's coming. And then by each age group and by procedure, they demonstrate how those therapeutic interventions are carried out. And in addition, we try to provide for the reader the resources that they will need to do the same work in their own organization.
When we started out on this project, we really wanted to write something that was different than the previous books.
Yeah, this is a very important point. This book is focused on surgical interventions. We openly acknowledge that we have not spent time on background information regarding the diagnosis of cerebral palsy and other interventions that are largely non-operative. This is a book that talks about when you've reached the point in time that you think a surgical intervention would benefit a child. For that other information, we encourage you to look at the last edition in the series or other resources that talk about non-operative care or about diagnosis.
One of the other ways that the book is different is that it's very heavily video based and is also with the new e-learning modules and online resources is really formatted in a way that it's approachable with a lot of videos to support the interactions that we have with patients and families, and also videos to support the surgical interventions, and then finally the rehabilitation. So a lot of videos about the rehabilitation process. And the text itself, instead of being a long prose and a lot of narrative, it's in a bulleted format, again, with the idea that we'd like it to be approachable to modern learners.
That's right. We understood from the steadily growing size of the prior editions that we had to be intentional about being succinct. And so Tom brought to us the idea of this more constrained writing approach. And our job as editors was to help the authors stick to that format. Again, that makes the book a little bit smaller, a little bit tighter, and there's less prose. But we think when supplemented by the videos, it provides the modern learner the information they really want. Today's learners do use videos, and we made an intentional effort to include videos with families, videos from the operating room, and videos as the children work with the therapists.
Each of the chapters follows a consistent format as well. So as the reader's going through chapter by chapter, they'll recognize a consistent outline and format for each. And then Steve and I recognize that this book is not the final end all and be all. There will be future books, and there need to be future books because there needs to be further research and knowledge gained about what interventions really have a long-standing, sustained impact for the future. And that will really, for the future of the individual's function and comfort, participation. And that will really provide us further information that will allow us to engage even better in this shared decision-making process that you were mentioning before.
We are offering you an insight into how one organization and its people working together across several disciplines try to provide the best possible care for children with cerebral palsy. This is how we're doing it now. It represents what we've learned over the last decade. It's going to change. We invited scholars from around the world to comment on what we're doing, and you'll see that in the book. We're hoping that you will read what we have done, work within your own organization to do even better, and then write about it and tell the rest of us what you've learned. Because that's how the best care will be provided, when lots of people work together.
We hope you enjoy the work. And I can say that we are certainly happy to be at this point of the process.
Right. The best book is a book that's finished.